Welcome back to the Health Up here on Newsfeed AM. I'm in conversation with Silverani Padayachee from our medicines regulator, SAHPRA, and Dr. Nicholas Crisp from the National Health Department. We're talking about COVID vaccinations for teenagers. And SAHPRA announced this weekend that it has authorized Pfizer's COVID vaccine for teenagers, and many parents are anxious to get their teenagers vaccinated. Dr. Crisp, we've seen a bit of a drop in daily vaccinations, and we know from what we've learned that each time that we open up for a new age group, there's a surge in the number of daily doses we administer, and then it drops again. So you've mentioned previously that there are many decisions and many decision makers when we need to decide when we open up for teenagers, and also that we really do need to first address people of a high risk first. But many people are asking, would opening up vaccinations for everyone of 12 and over not help us to reach our targets for December?
Yeah, thanks, Mia. So, I think that the question of herd immunity or community immunity that people have spoken about is really, it's a very elusive goal. And because of the way this virus is transmitted, even if all of us were vaccinated, there would still be some transmission. So that is not the primary objective. The primary objective remains to get to the people who are the most vulnerable so that they don't end up in hospital and they don't die. And part of the balancing act at the moment is when to boost the vaccinations of those who've already been vaccinated, particularly the healthcare workers who have been vaccinated since about the 17th of February. At what point do we boost healthcare workers to protect them, to look after us when we get sick? And that will require doses. Then there are also other vulnerable people in the community who may well benefit from booster doses, those that are immunocompromised for some reason. And then there's the question of extending to the younger population. So it's a number of competing demands and understanding where we get the biggest impact on society. You're quite right that what we see every time we open up an age group is that the initial group who have been desperate to be vaccinated rush to vaccination and get vaccinated very quickly. And then after that, for those who are either not really motivated and those who are hesitant because they've seen competing comments being made, and then there are those that are the small proportion, about 6%, who are absolutely anti-vaccination. So to get those groups of people who are hesitant or perhaps a little lazy to get themselves going, or for whom it's inaccessible, we need to target them. But that does not mean that we would exclude children just because we're waiting for those groups to up their numbers. And what we may well see is if we do open for another age group, of course that puts pressure on the vaccine that's available and may spurn older people to get vaccinated quickly before the vaccine is consumed by younger people. And we've seen that happen before. So there are many unanswered questions, and we are weighing up which sequence to do these various interventions.
Ms. Padayachee, has SAHPRA received applications from any of the other vaccine manufacturers who have COVID vaccines that are authorized in South Africa to have their vaccines also authorized for use among teenagers?
So we haven't received any applications yet for the widening of these indications to include younger age groups, but we do know that there are trials that have been approved. So some of them are currently busy with clinical trials for safety on these groups 6 years and older.
Dr. Crisp, if someone has a teenager and they want special permission to have the teenager vaccinated earlier, maybe because of an immune system that is compromised or because the teenager has to travel internationally, is there a process for that, and is it possible?
Yeah, thanks, Mia. So at the moment, we don't have a mechanism for recording vaccinations under the age of 18. If one opens it up to one, you basically must open it up to everybody. But what we do have is an advisory this past week from the Vaccine Ministerial Advisory Committee to the Minister on how to manage people who are immunocompromised, and particularly, obviously, those who are not in the age groups that have access to vaccines. We will be discussing that in the department this week, and we will be looking at the implications and the process that might be made available. That would have to be run outside of the mainstream vaccination program, obviously, because that involves a lot of taking of blood tests and certifying of that these are particularly risk children, and it's not just an arbitrary process. We also don't want to put children who have particular immune compromised disorders into some kind of risk, and that would need to be managed very closely by the clinicians who care for them.
Dr. Crisp and Ms. Padayachee, thank you so much for your time today and for joining us. That was Dr. Nicholas Crisp, the Acting Director in the Department of Health, and Silverani Padayachee from SAPRA, our medicines regulator.
So, Mia, the key takeaway from this interview is it's just because SAPRA has authorized a vaccine in a particular age group does not necessarily mean that we go all out vaccinating that age group.
It's actually two entirely separate processes. The fact that SAPRA has approved something or authorized something doesn't mean the health department is compelled to implement such a decision. So if you look at other vaccines, for instance, we also have Sinovac and AstraZeneca authorized in South Africa. But that does not mean that the health department is compelled to procure those vaccines. We don't use them at the moment. So important to note, what SAPRA decides does not translate into necessarily action for the health department.
Now, our next conversation is around transgender people and the struggles that they're facing in accessing health services in South Africa. So for those that aren't particularly sure what a transgender person is, please explain.
So a transgender person is someone who was born with a sex and their gender identity is different from that sex. So for instance, you might be born with a vagina and then as life moves on, you identify as a male later in life, or you might not identify as male or female, as a combination of it, and be non-binary. Now, some transgender people may undergo medical treatments to make their bodies a little bit more congruent with their gender identity. So if you, for instance, a trans woman, in other words, someone who was born with male genitalia and then has developed a gender identity of a woman, then you may need hair removal treatments or hormone therapy to make your voice a little bit, on your chest, a little bit more feminine, and you might, for instance, also need breast surgery. So when transgender people access such services, they really experience huge amounts of discrimination and also prejudice from health workers. And today we're going to talk to Zoey Black from Cape Town, and she is a trans woman and also a trans activist. Zoey, thank you very much for joining us today. We have a technical problem. We understand Zoey is not on the line yet, but we're hoping to get her soon to talk to us about her experience of gender affirmative care. In other words, surgery and hormone therapy that would help her body to be more congruent to her gender identity. We have Zoey Black on the line now. Zoey, thank you very much for joining us and for your courage to share your story with us today.
Good morning. Thank you so much for having me.
You are undergoing gender affirmative care. What does that entail?
So for trans people, that means effectively using medical care to affirm ourselves in our identities. And so for trans people, there are a number of options and medical care, the treatments available. And so these things may involve things like hormonal care. They may involve things like surgeries. For me, myself, I have been on hormone care for a number of years now. And I am looking to go and attempt to get some surgery done, because that is something that I feel I need to affirm myself in my identity.
Zoey, I've watched your videos on YouTube where you explain that you now would like to have breast surgery or care, and that you would have to pay in cash for this at private sector facilities, because in the public sector, this type of care is not that available. Tell us a bit more about it.
Okay, so I was in the public healthcare system for quite a while, and that was a difficult experience, to kind of put it mildly. In this country, we only have 2 state facilities that provide trans people with both hormonal care and surgical care. And so if you are wanting to get surgery specifically through the state, that waiting list is 25 years. So if I were to do this through the state, I would only be able to get this in my maybe 50s or 60s. And so these speak to how the resources are allocated and how resources are distributed for trans people. So medical aids in this country also do not cover any kind of gender affirming care at all. So trans people are left on their own to kind of figure things out. And so for me, what that meant was that I had to find the funds myself. So I'm in the process of crowdfunding for it, because one, the medical aids won't cover it, and two, the state, there aren't enough resources in the state to be able to provide that sort of care for trans people. The waiting lists are extraordinary in these state facilities, and it just seems like nothing has been moving for the longest time, and so there is a problem. And so the questions then are, I guess, for the healthcare sector, how do they then provide that kind of care, but particularly surgeries for trans people in South Africa?
So you've now spoken about the financial implications and also that it's hard to access such services specifically in the public sector. But when you do access it, what kinds of discrimination have you experienced?
I think to maybe just talk about it just a little bit generally very quickly, the trans people face extraordinary discrimination in this country globally. There was a study that was done in the US a couple of years ago that found the average lifespan of trans women of color to be 35 years. And that is the kind of day-to-day violence that we are facing. And so to get it more specific around my experience in the healthcare sector, it was extraordinarily difficult. From people doing, kind of double takes and kind of wanting to probe your body, kind of wanting to frame you in a way that there's something wrong with you, that you're not allowed to access this particular service, that you're not allowed to go into these particular spaces. Those are kind of very, not to trivialize them in any kind of way, but these are just the day-to-day things that we experience all the time on a day-to-day basis. And so there's a lot of work that needs to be done in the public healthcare system. I know Groote Hospital has had a number of training, and they have a specific unit that works with trans people to provide these services and provide them in an affirming way. But there is still an incredible amount of work to be done with these healthcare workers in order to bring them in alignment in terms of the values and the jobs that they and the services that they're providing. It has been very, very difficult.
I'm unfortunately going to have to interrupt you there. We really appreciate you pointing out the discrimination against trans people in South Africa, and also that our health services need to change. That was Zoey Black. She is a trans rights activist and a filmmaker with Iranti, an LGBTQI+ advocacy organization for trans people.
Mia, always good to have you on the show, and that is how we bring things to a close on this week's edition of the Health Hub. The appointment is set at 9 a.m. on Newsfeed AM for the Health Hub with Bhekisisa's Mia Malan, and she'll be back next week to give us the latest insights into Health Hub. Now, Newsfeed AM continues this morning. Stay tuned. When we come back, Linda Mabida, Deputy Manager for Economic Development at eThekwini, is in conversation with me. Stay with us.